joining me for another Friday chat. I'm really excited for the guest today, but before we get into it, just wanted to share a quick resource with you guys. I think everybody out there, and unless you work at Netflix or Amazon or a grocery store, you're starting to see some impact or beginning to get worried about the potential impact of this crisis on your employment. So someone passed along a great resource to me this week. I just wanted to share with you. This website, candor.com. I shared the link in the description. It's got a active real-time listing of all the companies that are currently hiring right now. So hopefully none of us have to use this, but just in case you do, thought it'd be a good resource for you guys. So I don't know about the rest of you, but I've learned more about virology and medicine over the last few weeks than I've ever wanted to. And I thought this would be a great opportunity to chat with a true expert on the topic. And one of the busiest ones in the world right now has been kind enough to share his time with us. Dr. Benhur Lee is a professor of microbiology at the Icahn School of Medicine at Mount Sinai in New York City. He's also a fellow of the American Academy of Microbiology, and he has a special interest in emerging RNA viruses and runs the Benhur Lee Laboratory, which is dedicated to the study of how emerging viruses spread and identifying therapeutic interventions to treat them. Doctor, I know you're extremely busy during this crisis, and I really appreciate you taking the time to share your thoughts and educate us.
Only because you're from UCLA.
Yeah, of course. Yeah, I know you've got you had an extensive background at UCLA, and that's a large portion of our audience here, so everyone appreciates it. So why don't you just tell me, you're based in New York right now. Obviously, we all know that's a hotbed of this crisis. Tell me about like what the last few weeks have been like for you and what you've been up to.
Yeah, and actually, I'm curious to also know how the world thinks about it because it must sound horrible reading from outside of New York. It is the epicenter of the world's pandemic right now. We have the highest rising number of cases, and today has the highest death tolls so far in New York City alone. So the curve is not flattening yet, but every time you have a lockdown, it takes about 6 weeks for any effects to show. So in terms of New York, you can really see the environment not deteriorating, but I would say that the crisis happening in front of your eyes. So Mount Sinai is the largest hospital system. I just want to say I'm here in my own capacity. I do not represent Mount Sinai, so everything I say is in my own capacity. Just have to say that because of legal reasons.
Of course,
But
we got you covered here. Don't worry.
yes, but this is public. You can see that the hospitals are strained now, and we used have a giant big lobby that's public, and now every square inch is converted into temporary bedding space because they're going to shift the patients up from their normal rooms so as to keep the flow of COVID-19 patients up in the actual rooms in the hospital. And right across the street in Central Park, there's a field hospital that's being set up by an organization. And those tents, the very same tents was just in Iraq, or Syria a month ago. So this is an organization that goes around the world setting up field hospitals, and it's fully equipped and is run under Mount Sinai right now. So a lot of things are happening. Mount Sinai is also the first in the country to try convalescent plasma human therapy, which is not really experimental, but it's been used for 70 years. But the process is not experimental, but collecting convalescent, that means people who have recovered from the disease, who have antibodies to the virus, and then infusing them into sick patients and helping them to recover. And so we are this institution to get emergency use authorization to start that. And so a lot of interesting things happening. Everything is in crisis mode, but people are coming together, and crisis always brings up the best and the worst in people. And the best is like these frontline responders are doing the best they can. I don't even want to say how much I work because everyone's working hard. Days go into nights, and You literally forget which day they are, but everyone comes together. There's no my lab or your lab anymore. I mean, the whole department comes together, and everyone creates reagents that's used by everyone else. And so we do our best to do what we're best at, and everyone gets access to everyone's expertise, and that's a really unusual. No, not unusual. We are a very collaborative department anyway, but it's very heartening and proud to see that happening, and so that's a good thing. Um, I don't know what else you want to know. I mean,
Yeah, no, I got plenty of questions for you, and I'm sure I speak for all of us when I say thank you for all the hard work you're doing. I can't imagine how stressful it is over there, but um, like you said, it seems like the crises like these do bring some good out of humanity. So I'm glad you're seeing that as well. I wanted to start at a very elementary school level with this. What is a virus?
oh, should have asked that first before I droned on.
No, no, that was great. You gave me a good perspective of what's going on right now.
Um, uh, you know, we all know what viruses are in a sense, right? You have your common cold, and they're caused by viruses as well. You know, can be caused by bacteria sometimes. You know, so viruses are packets of genetic material that code for proteins that make the virus replicate. But a virus itself is an obligate parasite, so it has to infect a cell before it can make more copies of itself. And it's evolved, the amount of viruses, the virome, is many orders of magnitude more than bacteria and eukaryotic species. I mean, species of a nucleus. So, but viruses by themselves cannot do anything. They need a host cell, whether it's a plant or a fungus or ant or mammals. Everything have viruses. Actually, the most abundant viruses are viruses that infect bacteria. These are called bacteriophages, and so each bacteria may have tens of different what we call phages that infect them, and so the viral kingdom is quite large.
So I've heard that a coronavirus is the same type of virus that can cause a common cold, like you said. So
Yes.
what's changed or what is so bad about what we're facing right now?
Coronaviruses are extremely diverse group of viruses, and so I'm not sure whether they're the most diverse among all viruses, but the global diversity is enormous. So there's probably about, I was just doing the paper yesterday, about an average of 3,200 coronaviruses in the world. This is by extrapolating when you sample bats. And so we only know a small fraction of them. There are most of them in bats. They don't. They transmit to very specific mammalian species. Of all the coronaviruses that we know so far, four, seven now, four causes causes about 25% of the common cold. And these four human coronaviruses we have known for a long time. When you go to a hospital, if you're bad enough, with respiratory illness during influenza season, they will try to rule out influenza. If not, they take a swab, they send it in. Magic happens. It takes in the laboratory, you know what happens, but we have what we call a respiratory panel, and we look for 22 respiratory pathogens at the same time. 17 of them are viral pathogens, and 4 of them test for the 4 common coronaviruses that infect humans. 2 of these 4 belong to the same genus called beta coronaviruses that SARS and SARS coronavirus 2 belongs to. So you can see even within the same genus, we have coronaviruses that causes relatively mild disease and coronaviruses that causes relatively severe disease. And like SARS, the original SARS from 2003, the MERS coronaviruses, that's even more pathogenic but not very contagious, that causes the Middle Eastern Respiratory Syndrome. And now this SARS coronavirus 2, which causes the disease we all now know as COVID-19. And this falls in the unbelievable sweet spot that is the hardest to control. So when you have something that's very that cause very pathogenic disease that's obvious, like Ebola or SARS, the moment the symptoms shown, you're like completely, the fever and you can't move anymore. It's easy then to identify and quarantine. This virus, as we learn more and more about it, turns out to be so variable. Like the incubation time can last between 2 and 14 days, right? So people can transmit it when they're asymptomatic. We did not think it was before, but now it's obviously true. And then the virus seems to be quite hardy on environmental surfaces, and which is why it causes, so it's a perfect storm of properties. And the worst thing is that the mortality rate is not, it's high, but it's not that high. So it's this, 1 and 2% thing that affects a specific age group. So there are people who get it who don't know it, and then there are very severe cases that you die from it. So that's why it's kind of a mess, because it's hard to identify and control.
And do you feel like at this point we have enough data to draw conclusions on it? I saw there's been a lot of controversy over some of the initial data that came out of China. Do you feel like we're at a point where we really understand this thing?
As a scientist, we never really understand anything. So we get closer to the truth. And so, flu has been happening for, 40 years of intense study, and we're still finding new things about it. So I would say the information that's coming out is coming out faster than before. This is arguably the first pandemic of the social media era, as evidenced by me talking to you right now. There was no such thing during SARS in 2003. You hear it from one authority. And so the particularly insidious about this pandemic is that the virus spread almost as fast as the information, actually vice versa. You get misinformation that spreads faster than the virus itself. So it's very hard to keep track of everything, because when you think about it, the world only learned about the virus, on 31st of December. And we didn't know that, and we knew about the first genetic sequence on 10th of January. That's 10 days later. In 2003, we knew about SARS, and it took us 4 months to get the genetic sequence. So that's how fast it's changed. And every day new information is coming out. So I would tell people to start practicing your judgment and critical skills. Not everyone has to be a scientist to be able to detect misinformation, And I'm not going to name particular news networks, but just because someone cites something doesn't mean it's true. Is it from a reputable source? Are there spelling errors in the citation? Is the logic correct? I mean, you just have to sit down and see whether it makes common sense. A lot of these things, can be, but then again, they are national websites, the American Society of Microbiology and things like that try their best to at least give what is up-to-date information about what they know.
Okay. And there's been a lot of controversy recently about whether we should all be wearing masks when we go outside. What can you say about that topic, and overall just about the spread of this disease, and like what's the best way to protect yourself from getting it?
Okay, so disclaimer, because this is all on my Twitter account, which it's inappropriate for me to say it out, but you can say it out if people want to know. That I have been transparent since a month ago that masks are important, right? So the viewpoint of the establishment or the WHO, and that's not the viewpoint of all countries, by the way, is that masks are not effective if you're not ill. It's effective if you're ill to protect the person from contaminating others, right? But that is disingenuous, because mask is not completely ineffective. If you wear the analogy is, if you're going to wear a seatbelt, it's not going to be effective if you crash into a concrete wall at 100 miles per hour either, right? But it certainly is not completely ineffective. It helps a bit. And what helps is universal mask wearage. So if you look at Asian countries, The ones who have been able to flatten their curve and control their curve are countries that have been sort of like inculcated, and that wearing mask is not a public shaming method. Doesn't mean that you have contagion. It's actually the converse, that wearing mask is a civic responsibility in times of pandemic to protect everyone else from yourself. I mean, Japanese national television just did an experiment where they have laser light showing, I mean, obviously when you sneeze, it's obvious it goes that far away, but it's quite remarkable that when you and I are talking, these micro droplets just hang around the air, and we're breathing in each other's micro droplets and stuff like that. And we know that the viruses are in these micro droplets, eventually they'll settle down the floor, but studies have now shown that these can remain suspended for about 3 hours in a room. Now, we do not know what the infectious dose is in these microdroplets, but you definitely can find viruses there. So my argument has been all along that, if you are in a place like New York, where essentially you have unabated community transmission, that means you have to assume that everyone is infected because they could be asymptomatic. Therefore, universal mask wearage will help flatten the curve because you reduce the human to human spread. Now, they argue, the health authorities, not to wear masks because they want to conserve it for frontline responders. True. That's a supply issue, though. So don't confuse it with an effectiveness issue, because then you're infantilizing the public by not saying, oh, you're too naive to understand why we need to conserve masks. Let people know there'll be creative solutions. People knit their own masks. People use bandanas on your own mask. You can teach people the right way of doing stuff. It's not going to be 100% effective, but there are modeling studies that show even 20% compliance can reduce infection. 50% compliance can reduce infection rate by 40%. So it's an important issue to wear your mask.
Yeah, I'm definitely seeing it more. I'm in San Jose, and maybe I'm a little biased based on the locality, but I see it more when I go out to walk the dog. And my wife just bought me and her some masks, so I'm getting
Yeah.
used to it myself.
Yeah. And I did not, I am not, I actually in the early days bring extra mask with me and give it to people when I see them cough. But I'm very aware that we do need masks and we're running out of masks. But that's a supply issue, and it's unconscionable that public health authorities and people who should be much smarter than me have not seen this coming, where little old me have, not just me, but like other people have been yelling and screaming that this is coming. But,
Yeah.
that's how the world works.
So to that point, though, like you said, everybody knew at some point there would be some pandemic like this, and it just seems like we've been ill prepared for it on multiple levels. What's your take on that? Like, what are some of the things that we should have done before this came, and then once we identified it, like you said, on the 31st, like what are some of the things that we should have done in the U.S.?
I'm not going to comment politically on the US because I think our public health authorities in this political environment are having a hard enough time of a job. So I don't want to make their jobs harder. What I will try to do is what the countries that have done it right. So
It's fair. I like
I
that.
think that's the fair way.
We can extrapolate from there.
Yes. So Singapore was marred by, I'm from Singapore, by the way, full transparency, even though I've been here for more than 30 years, right? But in 2003, when this SARS pandemic occurred, scarred by it because so many people died and they had to close down schools and everything. And so they learned from that. And since then, Singapore, being Singapore, is one of the most efficiently run countries in the world. I don't think anyone would disagree, you being a business graduate. And they had plans that they revised over the years. They drill. Every government agency has, a plan. They have like different health levels. So, for example, when this happened, the very first case that happened was detected in Singapore. I just happened to be in Singapore and that day, and I've never been back to Singapore in Chinese New Year for 30 years, but I was there, and they activated DROSCON Orange. There's no need for panicking. They have a government task force that was set up. All the government agency takes their manual down, from the shelf, just like airline pilot, flip to the right page, all the SOPs, everything is activated automatically about what to do, and so they have like immediate contact tracing, aggressively, the police were involved in contact tracing everyone around the index cases, and within 2 or 3 weeks they were able to contain that first case. So I think for quite a long time they contained about 91 cases, and that was it. And then that's one thing. And so then they built a centralized hospital, the National Center for Infectious Disease, where they could like put everyone in there to monitor. They have a system in place for monitoring home quarantine, either by cell phone tracking or by ankle bracelets. They don't play around. they, they're strict about such things. But risk communication is just as important, the science communication. So this is my mantra, and I've been saying that truth is the currency of trust in public health. You must be truthful and transparent at day one. So you go to the Ministry of Health, moh.sg.gov. They should be paying me for public affairs. And every day number of cases where they are is tracked, and so people know where they're coming out. And then there's a dispelling of rumors column on top, so people know exactly what the situation is. People know exactly what to do if they are showing symptoms. And the government comes out, and the government don't paint over stuff and say things are going to get better. Even when they're beginning to they've controlled the epidemic. The minister came out and said that it seems like we're going to control. That doesn't mean that we can't get imported cases that will flare up again. And that's indeed what happened. All the other cases, it's from imported cases, because there's no way you can shut your borders completely, But even then, they start to quarantine and cut. And that's one. Testing, number two. This I can comment on because it's really a monumental failure of, have to use PG words, monumental failure of the CDC, and there's just no way around it. And the CDC had very good people working, dedicated people. No one goes into public health to work to get rich, and they're hardworking people. It does not help that the budget was cut $100 billion in December, right before the outbreak occurred. So they're doing their best to do with what the budget cuts. I'm sure it's restored now. I don't know. But so they have to develop the test. And in America, it's a very litigious society. People are wondering, and this may be one of your questions, why is the testing so late and delayed? Because you need, high throughput testing in order to identify the people so that you can quarantine them. I mean, look at Korea. The moment they saw it developing, they did 20,000 tests a day and managed to flatten their curve. Here, in the early days, the strict criteria you have to meet before you can even send it for a test. And then you send it for a test, it takes 2 weeks to get the results back. That makes absolutely no sense. If you take 2 weeks for a result back, how are you going to contact trace and quarantine people? So that was a failure. You need to get quick tests, massive and high throughput testing out so that each individual state can do their contact tracing and quarantining, and there's a possible way of slowing it. But if you didn't do that, it's been spreading around the community. By the time you get the testing kits out, it's too late. It's true that we're doing more tests per day than any other countries now, but it's too late because it's not that we shouldn't do it. I'm just saying that the community spread has occurred. That's why we're having this lockdown situation that's occurring. I mean, it has already been set in process. The only thing we can do now is to mitigate, even with all the measures in place. You can see how our president has a change in tone all of a sudden. I've actually never ever seen him that serious before. Not that I look. Anyway, the point is that there's a change in tone last few days because even with the mitigation in place, there's going to be 250,000 deaths in best case scenario. If we start lifting our restrictions too soon, it may go up to 10 times the amount. And so these are sobering figures that we have to take seriously. And we're still learning a lot about the virus biology, about age group, about susceptibility. And so I don't think anyone should take it for granted just because you're young or not supposedly in the susceptible age group. There's just too many exceptions that we haven't found reasons for yet.
So you touched on Singapore, and obviously we were a little late to the game in terms of getting the same policies in place that they had. We had a question from Catherine Ulrich. She wanted to know what will be needed in order for us to open back up and start travel again. It
Yes.
seems like Singapore, after opening up, like you said, they've seen it come back in and they've had to restrict again. Like, what are we going to need to do?
The most important priority, and I think NIH got it right, I was just speaking, is, and the world governments know this, it's you continue on the diagnostic test because people are already infected, they're coming in. But people must also remember that even though today we had passed the million cases mark globally, there's also about 250,000 of recovered cases, that we know about, right? And since 80% of the cases are either mildly or asymptomatic cases, there are probably many more people who have so-called recovered. So one of the most important things right now is to get serological testing up and running. That means to test if people have been infected, whether knowingly or unknowingly, and then have converted, meaning they have made antibodies against the virus. So these peoples are the ones that are safe to release back into the community so that they can start the economy going again. Germany right now is pursuing a program where they are issuing what we call certificates of protection, or whatever the German word is, so that people, once they're certified, can be, be exempted from the lockdown and confinement rules, because the economy can't just stop for months on end. You need to have people with that, and there are people who are safe to go back who are in such clusters, and these are what we call the seropositive people who have converted, who have made antibodies. For everything that we know about virus and biology shows that these people are protected. They will not get the disease again. So whatever you read about, reinfection is not true. There are a lot of reasons explained about that. You will be protected for at least one, probably more than one season from everything we know about coronaviruses. Yeah.
Interesting. So David T had a question on that antibody test. So it sounds like the FDA approved a new test today. Is that the case?
Well, I actually haven't read out with the news today. It takes me.
Like you mentioned that we need that serological testing.
Yes.
Is it getting there? Like, do you see that coming out to market?
Yes, there are already commercial companies, German. I just saw one that's little kids. And not that I'm selling Mount Sinai, but Florian, my colleague, was the first one that published a serological test to detect for antibodies. And now there are kits, I think it's a German company that sells to detect human kits. So there are tests that you can do at home or at lab. No, at home. I mean, in an academic lab. But in America, if you want a clinically actionable test, because of the litigious nature of society, it needs to be FDA approved or it needs to be waived. We've got clear certification. And so that needs to go an approval if you need to act to clear people. But I'm sure that's happening because we realize that that's the only way to safely restart the economy again. And that's the fastest way to get there. Yeah.
Yeah, it seems like everything's getting fast tracked just to try to get it out to market.
Yeah.
So let's say somebody takes this antibody test, they've already had it, their bodies healed themselves. These would be the people that I would think we would want the convalescent plasma from, right?
Yes. And it's a project, and Mount Sinai is the first, I already said this institution to start people on this therapy. So we're collecting a donor base. What we don't know yet is, we're just beginning to characterize. All of us are outbred people, not like mouse colonies, right? All for the better. So we're going to have different responses. And in scientific terms, we call these the titer. So that means the amount of antibodies you will produce. And some people will produce very high titers, that means lots of antibodies. Some people will produce very low titers, little amount of antibodies. What we need to know is what is the minimum threshold that's considered protective or that's considered, useful to donate their plasma for such therapy. And that we're trying to define right now.
Leah Kozin had a question. How long can asymptomatic coronavirus carriers infect others?
Um, that question actually has two or three different assumptions to it. So, things are not as simplistic as soundbite. So, when you say truly asymptomatic people are probably rare, meaning they really did not know that they got it at all. So usually people are mildly symptomatic or subclinical, meaning all of us have days where we wake up and we just don't feel quite right because we didn't sleep right, and that could be it, and no fever. They said how long? Was that the question? How long can it?
Yeah, how long can an asymptomatic carrier infect somebody
Yeah.
else?
So that's ranging. The official definition is that the incubation period is 2 to 14 days once you get the virus. So if you're truly asymptomatic, they have done studies where they have swabbed noses and stuff, and it appears whether you're symptomatic or not, the virus load, meaning the amount of virus that you detect molecularly, don't seem to be too much different. So the symptomatic nature is due to something else. So they can definitely spread. We do think, however, that the more severe or more symptomatic you are, the bigger spreader you are, for obvious reasons, because you're coughing and sneezing around. So 2 to 14 days is what they're saying. There are case reports where virus can be detected up to 21 days after onset of symptoms, but it's not clear if that's just molecular. You can test it. That's different from whether that's infectious or not. So, but I think right now is 2 to 14 days is the right. That's why we quarantine people for 14 days.
That's interesting. So you said that people can have the same viral load. So asymptomatic and symptomatic, they would still have the same viral load.
Yes.
Wow, interesting. Um, let's see. Miguel had a question. According to the best information you have, when do you think we'll reach the apex?
Where?
When?
No, I mean where? In what
Oh
country?
yeah, where? Yeah, let's say the U.S.
In the US, there have been projections by respected groups, and I'm just recalling from memory. This has been done by Imperial College, by Harvard, by Johns Hopkins. It depends on how good the measures are. I'm saying a lot of caveats, right? So, but the consensus before these lockdown measures was applied was probably May or June. So depending on how severe the lockdown measures are being implemented and how well people are adhering to these lockdown measures, we may pick sooner or later. But I think in the next 2 to 4 weeks, we'll have a better idea. But I can say without a doubt that the next 2 or 4 weeks we'll see the worst wave coming. We have not seen the peak yet. That I can tell you for sure.
What's so hard about coming up with a vaccine for this?
um, I don't want to belittle the efforts. It's not hard. It just takes time. Your vaccines have to be safe, they have to be tested. You may hear words thrown around that we're trying to get a vaccine within 12 to 18 months. If that happens, that will be the fastest vaccine licensure in history. And because the world knows how important this is. Usually, a vaccine takes between 5 to 10 years from development licensure, and 12 to 18 months. It's already not cutting corners. It's really finding innovative ways to try to get the regulatory process up and running. But you have to do the safety studies because it's such a complex thing. The vaccine is not something that you just grow up and put it into people and hope it works, right? I mean, it could make the disease worse. There are a lot of scientific reasons why we have to be careful, which I won't go into. So, and my last count was 35 different vaccine candidates that are being tried that we know of, right, publicly. That discounts, the privately funded, what's happening in China and everything. So every country is trying their own thing, and so it's going to be an interesting challenge. But the greater challenge, and you as a business people will know that it doesn't matter. So you hear about Moderna, who's this RNA company, is already in phase 1 trials. They ship a molecule which is RNA that codes for the production of the protein, so it's faster to make you jab it in. Let's say it works, and let's say it works extremely efficaciously, and we can do it phase 3. They don't have the capacity to scale it up to make 1 billion doses. So the production process is what's the limiting factor. We can have know something that works in 6 months. It physically takes time to scale 1 billion doses, because what are you going to do? Make 10,000 doses? Who are you going to give it to? I mean, these are social ethical issues that come into mind. So when you hear about vaccines, you want to make sure that which are the companies that can actually have the GMP production plans to produce it, because we still need to produce influenza vaccines and MMR vaccines and all these other stuff, things that go around. So and companies don't like to invest in vaccines. They don't make money off vaccines because it's such a big liability. So hopefully this will change people's minds. Yeah.
We had a question from Eric Salkov. Unfortunately, it sounds like he says he did have the coronavirus for the past 3.5 weeks, and he wants to know, when is it safe for him to go out and for the rest of his family to come join him?
For 3.5 weeks?
Yeah.
What do you mean? He's symptomatic for 3.5 weeks?
Sounds like it. Or I don't know.
Well, assuming that he's at home, he's not one of the worst cases. So, pneumonia can take up to a month to recover. And that's why, even though we have 1 million cases, the recovery is only about 250,000, right? So we're missing 750,000 people. So those people are on the way to recovery. And so I would say that when your symptoms are completely asymptomatic, that's usually a good indicator. But if serology testing is up and running, whether it's by an academic lab or through a study, where is he from? Maybe that's not information I should know. But depending on where he's from, there are usually academic labs or hospital-based labs that are studying up serological studies that are enrolling, potential people who have recovered, and they can do the serological testing for you on a research basis if they are enrolled. Yeah.
Is there a good resource for people to find that information?
I believe I'm going to try to make one then. Something else from my lab to do. We have a COVID-19 comms blog page that's entirely run by PhD and faculty volunteers and crowdsourced and fact-checked. And so when there are relevant topics, they take over and someone writes a blog, and in layman's term, and it's been so popular, it's been translated voluntarily to several different languages, and so we think that's a good way to get the information out to the public.
Yeah, I've got the link to that in the description if anyone wants to check that out as well. Jonathan Butler, he asked, to what can we attribute California's relatively low rate of infection? Or do you think it's too early in the trajectory to make that assessment?
No, I think it depends on the city. I think we do have a sense exactly why New York is as bad as it is, and LA is not as bad. As I'm from LA, I've lived there for 13 years. My friends are still there, and it comes to, so look at our lifestyle in LA. No one takes public transport, right? Everyone drives in their own car. People live far apart. So the density is less. But you look at New York. Out in the subways, you have to line up for everything. You have to, in the cashiers and the groceries and things like that. All this was happening while the virus was spreading, and so that's why it spreads so much. But like in LA, we get into our own cars, we drive to work, we get back in our own cars, we drive home to work. There's not so much human to human contact, and so which is why I think if the lockdown procedures was implemented earlier, that's why it doesn't seem to be coming up as much. But San Francisco, which is a denser living, the rise is a bit higher. Although I think it was also one of the first places to do the lockdown earlier too, so they've stopped the rise a bit. But New York City is an example, and now you're seeing many other cities that have that kind of social, like New Orleans is an example where you have crowded neighborhoods in sort of like the lower socioeconomic strata, public transportation and stuff like that, and it looks like they're on the same kind of trajectory that Wuhan is. I mean, New York is on a steeper curve than Wuhan ever was at the peak. So because we started our lockdown much later, and so New Orleans, the few other cities that was mentioned, Atlanta, um, Detroit. So it's crowded, dense cities with public transportation. Those are the kind of places that will give. But LA supposedly has public transit, but no one takes it. So
Yeah, I've lived in both New York and LA, so I could definitely agree with the differences you struck there.
yeah.
Shireen asked, can you get infected by going on walks outside or going to the stores and walking by people who may have been infected?
So, social, these things are hard to answer in specifics, but I'll answer in generalities. Social distancing measures are imposed for a good thing. They're about 6 feet apart because, droplets will fall by gravity at some point. Nothing is 100%, but I tell you what I do. I have 2 dogs, right? We're on lockdown. We have to bring them out to walk. And so even in a building, it takes me, I have a set of clothes because you never know. Fomites are things that are in the environment, right? They're viral droplets, they fall on the ground, they're surviving there. You walk on it, your shoe may pick that up. You walk in your apartment, if you have pets. I mean, it can be transmitted to you if you touch your face. So there are lots of ways of indirect transmission. So the way I do it is that I have outside, I have inside clothes. So New York is still warm enough yet. If I go out, even bring my dog, I wear a mask, I wear a knitted cap, I have my outside jacket, I put on my sweatpants. I have shoes that slippers or what? Actually, shoes. They're covered up. That I wear for the outside, and then after my dog comes back, I don't go into my apartment. Right, there is an area outside my apartment that's. I have a can of Lysol. I spray everything down. I have Kleenex wet wipes. I have a procedure where I wipe down my entire dog paws and everything. It takes about 10 minutes, and then so once they're clean, I let them back in clean, and then I Lysol the shoes that I walked outside in, and those then get put into the bathroom always, and then everything that's on the outside I take off and I immediately throw into the dryer for half an hour on high, and that will do for anything. That makes it clean again, so I can reuse it. So half an hour in the dryer is nothing at all. In the morning when I pick up newspapers, they go straight into the oven at 180 degrees for 5-10 minutes, and that will do anything. I do that at the mail as well. So that's my way of trying to flatten the curve.
Wow, no, that's all great tips. My wife's watching right now, so I think you just changed my day-to-day life quite a bit just there. Um, let's see. David Ross asked, if the virus drops to the floor inside, will it last longer there than it would last in the air?
So the virus on contaminated surfaces, there's not a real difference. The virus is, it's going to be infectious. It depends how long they drop to the ground, and the surfaces matter. So these studies have been published. Even though they are artificial, the half-life of these viruses differs. So on certain hard surfaces, it's maybe 24 hours. For some reason, on cardboard, it's up to 72 hours. And so, it depends on the surfaces. But and it depends on the infectious load. So when we say things can survive up to or 72 hours, they're usually talking about a half-life, right? And so if you need a certain amount for it to infect yourself, you may still have virus there, but every 72 hours or every 24 hours, half of it is no longer infectious, and so it gets safer and safer as time moves by. So if you're worried about, oh, is this pair of jeans has been contaminated, is that if you know that that has been sitting in your closet or that has not been touched for a week, it's definitely safe, because even if it was contaminated, the virus would have been dead by then.
I read this in one place and it was likely misinformation, so correct me, but I've read that it's relatively unlikely, or at least lower likelihood, that you would get it through your mouth. You're more likely to get it through your nose, eyes, or ears.
Oh, okay. I don't know who said that.
No good? All right.
No, that's no, that's worse than inaccurate. That's dangerous.
Oh, wow. All right. I'll delete that from the video then.
Yeah. No, so we have to practice good hygiene. I mean, breathing through your mouth, just you're gasping more air in rather than breathing through your nose. And breathing through your nose, your mucus and nose hairs have evolved to help sort of like trap pollutants and stuff like that. That's why people don't usually breathe through your mouth, because you get dry mouth. Your nose is meant for breathing. So, and the epithelial cells in your upper respiratory tract, and those are the cells that the virus first infects and replicates before it travels down and get into your lungs. So no, I wouldn't breathe through my mouth.
All right. Richard Mack asked, it's a question about reopening the country for business. Should we be paying attention to the number of ventilators we have and ICU beds? As long as we have that capacity for those two items, should we reopen?
We don't have the capacity for those two items.
I guess if we did get that capacity, would it be safe to reopen, or you would still keep things locked down?
Like I said, there's a path forward to reopening, and that is to test people who have recovered. It's not a yes or no answer. It's a gradual answer. You let the people that can be safely get back into economy, get back into economy.
Anita asked, usually kids are more prone to viral infections. Why is this affecting adults so severely?
So that's a very good question. Of course, there have been cases of kids and infants dying of the disease as well. So we have to find out what's the cause of that. In general, when you grow older, as in this case, a phenomena called immune senescence sets in. So we have immune systems, and our immune systems sort of like deteriorate with age, because that's what age does, But there's two parts: your adaptive immune system that makes you make antibodies and stuff. There's also your innate immune system, which is the first line of defense when the virus sees the cells. Those all gradually deteriorate for all kinds of different reasons, and that could be one in which why the generally elder adults are coming down. The demographics, and I'm trying to say this very gently because the data is still coming out in America, seems to be slightly different if you aggregate it. So in the cases from China, I mean, it is still true that the 70s, 80s are the most the case fatality rate is the highest, but it looks like there are more people in their 30s, 40s, and 50s here that can get severe disease too. And I'm not sure if it's linked to obesity in this country or things like that. So I think the data is coming out complex from different countries. We have to look at it. Yeah. But kids are generally more resilient because especially teenagers and stuff like that. They're in the prime of their life and stuff like that. They got their vaccines already from childhood, and so they're usually quite good. They're active, so they don't have a lot of the sort of like predisposition conditions that will make people ill.
And it seems like men are more impacted. Any thoughts on that?
That is not true. That data was originally from China or in other countries, and that's because in China, men smoke more than women by a factor of 6 to 1. So, and smoking leads to chronic lung conditions and pollution. So, all those explains the epidemiology of why there's such a big male to female ratio. But that's not. I don't think that's true in America, and definitely not true in a lot of countries that do not smoke. So,
All right, that's some good news for me. I like that.
yeah.
What are your thoughts on the actual numbers that came out of China? Do you think the numbers are much higher than what was reported?
Oh, so tired of having to address this question. And you know, uh, so yes, China did try to cover up their initial cases, and they have a different political system. They were supposed to have a system in place after SARS 2003 so that this won't happen again. Leaders change. People are afraid to upset their leaders, so they want to keep bad news. A lot of things explain it. But once it was out, they acted with force and locked down the country. And if people don't believe that they actually have locked down the country and the cases are not coming up, they don't have to look at the data coming out from China. They can look at NASA satellite imagery. So this is all online. And there are pictures of it where there are satellites monitoring for nitrogen oxide production, which is an indication of industrial activity because they come from cars and stuff. And you can see between January 1 and 25th, and then between February 1st and 25th is night and day. I mean, the country is gone completely silent. You have the same images for Italy too, although not as great because the lockdown was not as severe. So they did really lock down the country, and now they're gradually reopening the country again, and it looks like the cases have not gone up. So if that's true, we'll see. They just recently reopened Wuhan. That must mean, and there have been studies coming out, that the virus really have infected a much larger percentage of the population than we know, because they can't test everyone either, right? And so that's the only way to explain how when people start coming back to work and mingling, and you still don't get enough cases, that a lot of people have already been infected and recovered, and that's why you're immune. And that's why we're trying to do serological testing, because that's the way to get the people back into the economy again. Because for all we know, maybe half of us are already seroconverted, and we don't have to worry, so to speak. So I think we really need to know that.
I'll ask you one more, and then I'll let you get back to your work. Larry Jen asked, are there any natural supplements or herbal remedies you would recommend to help build immunity or resistance?
No.
All right, that's all right. I'll ask one more since that was so quick. Can dogs get the coronavirus from humans and give it to other humans?
Oh, there's a famous case in Hong Kong where the dog of a patient became weakly positive, and the scientists did 4 different tests because they wanted to make sure that it's correct, and it was weakly positive, and there's no evidence that the dogs can transmit it to humans. So they may get it's that one case, they may get weakly positive, right? Not in the sense that humans cough and transmit it, but that doesn't mean that dogs can't inadvertently transmit it by, let's say, an infected person coughing into his hands. Cute dog comes along, oh, how cute, rubbing his hands all over the dog. Dog goes back to the owner's apartment, and then the owner rubs the dog and touches his face. That can be transmitted that way. That's not the dog's fault, though.
Yeah, we bought our dog shoes that we take on and off every time we go for a walk.
That's a good idea.
I think we're going to start doing the full wipe down you recommended. We haven't been doing that. Awesome. Well, thank you so much for taking the time. Really appreciate all the work you're doing, and I personally, I learned a ton from this conversation. So thank you so much.
All right, you're welcome. Good luck.
All right.
Be safe.
All right. Thanks everybody for joining.